My name is Elizabeth Edsall Kromm, and I am the Vice President for Population Health and Advancement with Howard County General Hospital. When you think about a population overall, people are going to fall really along a spectrum or a continuum. And if you look at the very top of a pyramid, or the very far right of a continuum, you have individuals who are very, very complex in their needs and their healthcare issues. Overall, these individuals tend to be older, not necessarily all of them, but several of them are over the age of 55 or 60. With that, once you advance in age, most likely you have one or more, or often between 2 and 6 chronic conditions. So not only do you have diabetes, but you also have hypertension, you have high blood pressure, you have other things going on, and you're taking multiple medications. Another thing that puts somebody at risk of being in that top of the pyramid and needing a lot of care and support is not having a medical home. So you have multiple chronic conditions and you're taking multiple medications, you're seeing several different specialists, but you have nobody who's really serving as the quarterback for your care to manage your health in partnership with you. So that really puts somebody at an additional risk of ending up in that sort of top of the pyramid that we talk about. The other piece is social support. So if you do not have a family member or a loved one or even a neighbor who's able to provide support for you, that definitely puts you at risk, because not only are you trying to deal with your health issues, but you don't have a way to get to your doctor's appointments, or you don't have a way to afford modifications to your home to allow you to remain in your home and remain independent and living independently as you age. When you think about the factors that affect our health, actually over 50% of the factors that do affect our health are not related to access to medical care. The largest contributors to our health are socioeconomic factors, so your income, your education, your employment, your community support, your family support. In addition, you have the built environment, or environmental factors. So how clean is our environment from a pollution standpoint, or from a policy standpoint, in terms of, do we have the right policy supports in place to create a community that is a healthy community that enables you to be healthy and live in a healthful way. The other piece, large component of what contributes to our health, are modifiable risk behaviors. So when you think about tobacco use, or unsafe sex, or unhealthy eating behaviors, that's really the largest piece of what impacts our health. And then you get down to about 20% at the end of the day is medical care and access to care and high quality care. So all of that together makes up the factors that contribute to our health. But when you think about the majority of it, it is those things that occur outside of our hospital. And that's why we need to focus in those areas and partner with key organizations like our health department and like other county agencies whose job it is to assure and protect the public's health. We're working alongside of them when it comes to policy development and it comes to other interventions that were impacting that large segment of the factors that lead to better health outcomes or poorer health outcomes. When you think about the health of a community and sort of the individuals who are involved in managing and promoting and advancing really the health of the community, there are several players involved. No one individual institution, whether it's the hospital or the health department, can do it alone. And so we're very fortunate here in Howard County that we have a whole network, a whole coalition of individuals from the health department, from county agencies, public and private entities, nonprofits, businesses, and the hospital, who are actually very aligned and working together to advance the health goals of our population and to ensure that where disparities do exist, we're actually tackling them and getting to the root causes of those and fixing them.